All right, so today I'm going to be going over the plastinated heart, and I'm going to go over the structures and the pathway of blood through the heart so we can kind of understand why these structures are important. To first orient ourselves, we're going to start with how the heart is positioned in our body. So if I point the heart, right, this apex of the heart here, if I point it down, right, if I point that down, and I point the heart back a little bit, right? So imagine if you were looking at the top of somebody's head, right? If you were looking at the top of somebody's head and you were looking down at their heart, right? This is how it'd be positioned, right? Down and to the left, right? And then slightly back, right? So that's kind of the perspective the video is being taken from. So we have that, right? So now we're going to look at the structures. So the first structure that we're going to look at is the right and left auricle. So remember, this is the right side of the heart, right? This is the right side, and this is the left side. So right, left, right, left. So this is the right auricle. This is the left auricle. And then moving on, we have the aorta, right? This is the aorta. That's this structure here. Right, you have the ascending and then the descending, right? This is the arch of the aorta here. Right, off the arch, you have the brachiocephalic trunk, right? This brachiocephalic trunk splits into the right subclavian, and it's also going to split into the right common carotid. So right subclavian, right common carotid. And then you also have the left common carotid and the left subclavian artery, right? So those are the branches, right, of the arteries that come off of the arch of the aorta. The next structure that we have is the pulmonary trunk. We can see the pulmonary trunk here, right? You can see the trunk, and it's also splitting into the pulmonary arteries, right? That's the structure that we're seeing here, pulmonary artery. Right, we're seeing portions of the pulmonary artery here, right? So, right, this is the pulmonary artery. And then we also have the pulmonary veins. So the pulmonary veins going into the left atrium, right? You can see the pulmonary veins. See pulmonary veins, right? All of these are pulmonary veins, right? So some of them are being covered or occluded by the arch of the aorta, but we can see the pulmonary veins here. Pulmonary veins. And then we have the superior inferior vena cava. So, right, the superior vena cava oftentimes gets confused with either the pulmonary veins or the pulmonary arteries, right? Because it's close by. But this is the superior vena cava. This is the superior vena cava, right? And this is the inferior vena cava. If I were to put a probe through it, right, you can see it there, right? Superior, inferior vena cava. Right, so superior, inferior. And then also, if I look at the aorta, right, there's two arteries coming off of the aorta, the right and the left coronary artery. So this is the right coronary artery. It's branching and wrapping around the back of the heart, right? And then it gives off a branch to form the posterior interventricular artery. Interventricular is just denoting in between the ventricles. So, right, it's on the posterior aspect of the heart, and it's running in between the right and the left ventricle. So, right, so that's where we get posterior interventricular artery branching off of the right coronary artery. We also have the left coronary artery, right? We can't see it because it's being occluded by the pulmonary trunk, but we can see its branches. So left coronary artery is going to come off the aorta just like the right, but on the left side, of course, and then it's going to give off a branch to form the anterior interventricular artery, right? Anterior, right, just meaning that it's branching on the anterior aspect of the heart, and it's in between the right and the left ventricles. And then also we have the second branch of the left coronary artery, which is the circumflex artery. Right, and that's this artery that we're seeing here. Right, you can see it branching, right, going sideways or curving. Right, that is the circumflex artery. All right, and now we have the coronary sinus for all the cardiac veins that we're going to be able to see in the wet lab, right, all the cardiac veins drain into the coronary sinus, and the coronary sinus drains into the right atrium, right? So once all that blood gets used up by the actual tissue of the heart, by the muscle of the heart, right, once that blood is deoxygenated or has a lower content of oxygen, it's going to go right from the muscle of the heart, and it's going to drain into the coronary sinus via the cardiac veins, and then it's going to drain into the right atrium, and it's going to continue the pathway of blood flow through the heart. All right, moving on, we have the atria. So we can't really see the right atrium because of the way the heart is cut, right? It's kind of cut more so to the left than it is the right, so we're seeing a lot of the structures on the left side and not a lot of the structures on the right side. So we can't really see the right atrium, right, unless we're looking at it from this perspective. You can kind of see a little bit there, but not really that much, right? So I'm looking kind of inside the right atrium there, right? You can see a little bit of the right ventricle from this cut, right? This is the right ventricle, this is the right ventricle, right? Imagine if I'm cutting a balloon, I'm seeing two insides of that balloon, right? So if I'm cutting through the right, if I'm cutting through the left ventricle, I'm going to be able to see the two sides of the left ventricle. Right? If cutting through the left atrium, I'm going to be able to see the two sides of the left atrium. But like I said, we're too far to the left to be able to see a lot of the structures on the right. Right? So you can't see a majority of the right ventricle, which is here. You can kind of see a sliver of it here and a sliver of it here, but most of the ventricle, the right ventricle, you cannot see. All right, moving on. Now we're going to move on and look at the left atrium. So this is the left atrium here. Left atrium, you can see the pulmonary veins there. Right? You can see the pulmonary veins there. And then from there, we have the left atrioventricular valve, the mitrid, or the bicuspid, right? So those three names denote the same valve: left atrioventricular, mitral, bicuspid. We could also see the chordae tendineae. You can see these little valves connected to the valves here. These little strings connected to the valves are the chordae tendineae. Right. And then we also have the papillary muscle, right? These little hills that are connected to the chordae tendineae, so the papillary muscles. Right, and then you also have the trabeculae carneae, which is the muscle in the ventricular wall. Right, so trabeculae carneae. You have the pectinate muscle in the right atrium that we can see actually inside of the donor's hearts, but we cannot see it here. So, right, remember the muscle and the ventricular walls. We can also see the aortic semilunar valve. So, right, you can see these cusp here. Right, this is the aortic semilunar valve going into the aorta. So if I close it, right, this would be the aorta, ascending, descending. You can see the arch, right, and that would be the aortic semilunar valve. All right. We can also see the depression here, right? This is the fossa ovalis, right? In fetal circulation, the pathway of blood moves very differently through the heart. So the atria are actually connected, right? And blood can flow between them, but once a child is born, right, this begins to form a depression, right? And the atria are now separated. So this is the fossa ovalis. Right, now I'm going to go through the pathway of blood through the heart real quick, and then we're going to look at maybe one or two more hearts just so we can see some of the different structures and how they differ, and that'll be it. So to start off, right, we're going to be looking at systemic circulation. So systemic circulation is from the rest of the body to the heart, or from the heart to the rest of the body. So coming from the superior and inferior portions of the body, we have blood going to the superior and the inferior vena cava. Right, so blood going to the superior and the inferior vena cava. We also have, I'll go over that later. So superior, inferior vena cava draining into the right atrium. Right, from the right atrium, blood moves through the right atrioventricular valve or the tricuspid valve, and then it's going to move into the right ventricle. From the right ventricle, it's going to move into the pulmonary semilunar valve. Right, from the pulmonary semilunar valve, it's going to go into the pulmonary trunk. Right, from the pulmonary trunk, it's going to go into the right and the left pulmonary arteries. Right, it's going to go to the lungs. It's going to become oxygenated. Once that blood gets the oxygen it needs, it's going to move through the pulmonary veins, right, which are these structures that we're looking at here. So pulmonary vein, right, pulmonary vein. If I turn the heart around like this, right, it's a pulmonary vein, right, blood is going to move through the pulmonary veins, right, and then it's going to go to the left atrium, right, so that's the pulmonary veins that we can actually see from the bisected cut of the left atrium. Right, so blood is gonna be here. It's gonna have the oxygen it needs to pump to the rest of the body. It's gonna go through the mitral, bicuspid, or left atrioventricular into the left ventricle. Right, so from the left atrium to the left ventricle. Right, we have the papillary muscles here. Again, you can see the chordae tendineae, you can see the trabeculate carneae, and then from the left ventricle here, it's going to move into the aortic semilunar valve, which is this structure here. From the aortic semilunar valve, it's going to move into the aorta, and it's going to pump to the head and the neck. Right here, we can see blood is going to move into the brachiocephalic trunk. It's going to move into the left common carotid, left subclavian. It's also going to move to these coronary arteries here, and it's going to be supplying the actual tissue of the heart, right? So it's going to go through the right coronary artery here, right? It's going to supply the posterior interventricular artery as well, that branch off of the right coronary artery. It's also going to supply the circumflex and the anterior interventricular. It's going to be supplying this portion of the heart here, right? It's also going to be supplying this here. And then once all that blood gets used up by the heart itself, that blood is going to go through the cardiac veins, and it's going to be draining into the coronary sinus, right? And the coronary sinus is going to drain into the right atrium, right? And then the pathway of blood just continues and recycles and happens over again. Right, so that's the pathway through the heart. That's everything that we need to know for that. But I'm going to look at maybe two of the hearts and see how they differ, right? So this heart is a lot smaller, right? Again, all of them are cut and bisected so we can see the left more than the right, right? So we're seeing here, we can see the left atrium, left ventricle, like the valves have been cut more, so we can't see them as pronounced as they were on the bigger heart, but they're still there. They kind of just flattened a little bit. You can still see the papillary muscles. Right here, you can see a little bit better perspective of the pulmonary semilunar valve. Right, a little bit better image of the right ventricle there that we can see. Right, you can see the aortic semilunar valve. Right, you can see the pulmonary trunk here. You can see the pulmonary veins, right, that are draining into the left atrium. Right, you can still see the right coronary artery, right, which is splitting into posterior interventricular. You can still see the coronary sinus here. You can still see the left coronary artery, but a little bit better, but still not as pronounced as it would be on the actual heart where you can move the pulmonary trunk. You can see the circumflex, right, and And one thing I like about this heart is a lot more pronounced what some of the structures are. So you can clearly see that these are the pulmonary arteries, right? These are the pulmonary veins. It's a little bit more clear when the heart is smaller. Pulmonary veins. And then you can see the inferior and superior vena cava a lot clearer. All right, so it's a lot, this one's a little bit more clear, it's just smaller. Now if I move out the other heart here, you can see the other hearts. All right, this one. All right, we can see a lot of the same structures. You can still see the right coronary artery. You can see anterior interventricular. You can see the auricles. You can see the arch of the aorta. Right, you can see the arteries that are coming off the arch of the aorta. Right, you can see the superior and inferior vena cava, the pulmonary veins here. So those 4 pulmonary veins, 1, 2, 3, 4, and the pulmonary artery, right, branching into the left and the right pulmonary artery. Right, and if I open up the heart, right, so a lot of the same structures, well, all of the same structures really, but you can see the pulmonary semilunar valve coming from the right ventricle. You can see the aortic semilunar valve coming from the left ventricle. All right, you can see the left atria here. You can see the pulmonary veins. All right, you can also see the coronary sinus on the back of the heart. You can still see, right, same place, draining into the right atrium there. Yeah, that's about it. I hope this was helpful. And I hope you guys can utilize this video and help yourselves get a better understanding of the heart. All right, good luck, guys.